You are watching Wide Field with Vivian Birchall. This is Wide Field.
Welcome to Wide Field. I am Vivian Kobusingye Birchall, your host, and today's special guest is Dr. Sine Aras Akten. And Dr. Akten is the Director of Specialty at NYC Health Plus Hospitals in New York and is an Assistant Professor at Sine Aras Medical Center. She is a double board certified by the American Board of Internal Medicine and the American Board of Nephrology. She maintains a professional membership with the American Medical Association, the American Society of Nephrology, and the American Society of Transplantation. She is also a recipient of the Best Clinician and Best Resident Award. Welcome to Whitefield.
Hi, Vivian. Thank you for having me here.
It's a pleasure to have you here. And Dr. Sine is going to share with us her experience on the COVID-19 frontline in New York, which has been the epicenter of the epidemic in the United States for some weeks now. And if you have any questions, you can text them in the chat. And with that, I think this is the first Zoom interview for Whitefield. So if there are any glitches, we apologize, but you'll just bear with us. So Dr. Sine, what is your memory of the first COVID-19 case that you treated?
My first memory is like sort of invisible enemy feeling, like you do actually treat the patients, or my first patient actually, you don't know anything about it, but you are suspecting something. And then this is most likely infectious disease, but you don't know how it's related or how it's going to contagious to the others. So I am thinking like the first memory that the unknown, like the feelings for the unknown. I was actually, like, as you mentioned, that I'm directing, like I'm more administrative roles, and I'm doing like kidney specialist role, which is nephrology role in my hospital. But since we started this pandemic, so we've been changed the roles to be like more active and the frontliners. So I start seeing the patients. My first flash memory, which is actually like yesterday, is regular ER. We have 35 patients bed, and I went into like a first day, the first week, it's the third day, a lot of patients. Almost like stuck to each other, that's trying to like get help, and that's and one of like a bunch of it like really sick that you need to immediately like work on it. The rest of it, like they are really moderately sick, but you need to like pay attention. But what I was feeling like that whenever that moment that I remember, we just like really running to just help the patient, running around the clock to just like intubate the patient who needs like a more respiratory support, and just try to triage them, just try to isolate them, because you don't know who is sick, who is not sick. You don't want to expose them. And it seems like a battlefield that I was feeling. That's why I did my interview with my hometown, saying that I am feeling like soldier on the battle, and this battle like is not going to end very soon, that we realized in the first week of the pandemic.
So when you mentioned about helping the patients, I'm going to just play a short video here, and then after this video, tell us what was happening.
Today is actually 3/27, so it's my actual third week. In role, like I am on call. I'm a nephrologist, I'm covering nephrology, and also I'm covering ER for admitting for our department 2 days in a row. So I was having some symptoms, and not feeling well. How are you going to do it? We should do it. We have 8 extra virtual admissions and 150 case overnight. So it's hard. What are we going to do?
The first memory that a lot of crowded sick patients coming into very well-oriented but overcapacity emergency rooms. That's what I had. Like the video that we showed right after that, I did admit so many patients into our hospital and also like sent them to like a vicinity hospital. But after 2-3 weeks, so we did all hospitals come like to overflow. That's why we were thinking as a general in HHC, which the company that's serving almost 7.5 million New Yorker per year as a service, we've been overwhelmed, and then we were thinking about what we're going to do during this like this pandemic episode, which is we thought like it's going to be beyond our expectation. So I thought that as a like New York, we've been not ready for that kind of crisis. We did not have preparation for that like kind of very heavy influx or very heavy patient care. So we've been seeing, that's why I was going to tell you, we've been seeing in the beginning first 3 weeks like small items to mask to like a big items that ventilator or dialysis machine like shortage. These shortages are giving us many times struggle to really navigate the patient care. However, also we've been really dealing with the entity that we don't know, first of all, and this entity, when they make you sick, real sick, that's unfortunately mortality rate, like that outcome is so high likely. So that's why we were feeling like, okay, we are in the middle of something. We did not have a prepared guns for it, and then we're trying to handle like how we can navigate the patient, how we manage the patient. In the same time, as I'm actually like a nephrologist, I try to learn about what is causing, what this virus is causing antibodies that make the people that sick. We came to like, this is the seventh week. We have been understanding a little more about the virus itself, and now we are more managing the cases and like definitely like population and influx and many things about the virus. Unless I could say like testing still like as a problem.
Yeah. And that was also one of the ties into my next question. I was going to ask what your concerns are as doctors on the front line. What are some of the biggest concerns?
That's why I was like trying to get the topic to the personal, to a little bit more like healthcare professional or frontliner perspective. Our concerns are safety. Like our safety is the concern. Still in the I am sometimes maybe exaggerating, because we were seeing a lot of bad cases, unfortunate cases. But when we talk each other, the first concern, first of all, how long does we should live like this, because you're giving many equipments to see the patients, and then in the meantime you are sometime, not like all time, lack of like some kind of personal equipment protection, that is causing you the fear in your heart, like am I getting too much exposure to this virus more than ever, and it is dangerous, or is it dangerous? You never know, like, is it dangerous to see 5 patients, 10 patients, 20, 30, 50 patients? In the end of the day, you expose more, the more likely, as a logic, you're going to expose the disease itself, and you're going to be diseased in the end. So that's the fear of the doctors or nurses or healthcare, any part who is in the hospital, like any part of the roles. Everybody has this. How long should I be exposed to patients? That's the main concern. So because of this is going to affect your job quality, and most likely like duration of how long you should do that. how long you going to do that, or how long you could do that. That's kind of the main concern. If I say the second concern, that your patients are not treated like what we were seeing, like there's no like protocols established yet. As a doctor, I am feeling like hopeless most of the time. I'm using some of the protocols that be not shown any efficacy like on the cases, but I have no choice. I need to do that still, and I'm still seeing the same results. This is heartbreaking, and at the same time discouraging me to do my job. Like for the first time in my life, I said to my husband a couple of days ago, I love to be doctor in the beginning. I love to treat the people. Forget about the title. I love to treat the people. Nowadays, I love to treat them, but I cannot help this. I cannot help position like when you circle yourself. You're doing like a great job on the field that you are trying to do, to get like most of the people out of the concern, but the other people that you couldn't help make you still like a bothering. You want to like do more. My second concern definitely needs to be we need to find the cure. We need to find the treatments as soon as possible. Like that could be the probably like the light in the end of the tunnel for that kind of crisis.
Right. And you have, before I get deeper into what symptoms you have witnessed, just piggybacking on you as frontline doctors, recently, just yesterday, one of the New York nurses lost her life. She committed suicide, and an ER director, a director in the ER of the ER. What can you tell us about that story?
Unfortunately, like the doctors are like the healthcare professionals are increased rate of like depression rate. This is a ongoing, as I told you, like almost battle-like field, and we need like a more support. Very happily, we have a very great support line in cooperation in hospital. So, and also very happily. Hold on a second. I'm so bad. Like, gosh, something like is like wrong here. Okay. Very happily, we are actually getting like enough support and emotional support. However, I think that we probably going to need more incoming, or maybe like more intense treatment on ourselves. Like we know that when you have that kind of trauma or traumatic events, you are developing some degree of mental adjustment, like not a disorder, but like unfortunately like events. So I believe that we need to definitely focus on that part as of now, to just prevent like a further decline in mental clarity in healthcare professions.
Right. There is so before I ask you about one of the images I have from you, what are the most common symptoms you have witnessed? The COVID-19 symptoms, that is.
Yeah, cough and fever. I mean, like the COVID-19 has lots of manifestations. The cough, mainly dry cough, and like fever, we are seeing all of the time. Like patient has like a like even red eye and chest tightness, chest actual like breathing problems, and even though like they don't have any problems, but they were developing like smelling, like sense loss. That's so interesting, the smelling loss and taste loss, and very badly, if you have very badly injured, that you are really coming with unconsciousness and confusion, seizure. And if you have any like a particular wound, this wound is getting bigger and expand. Like it's so interesting like involvement that I am seeing each and every time. So, but the mainly, yes, coughing, dry cough, fever is the main, and the breathing problems that we've been seeing in the patient. Yeah.
And can you give us an insight on what happens to the human body after someone has recovered from COVID-19, especially those who are hospitalized and intubated, and even those who haven't?
Okay. So when you are hospitalized, probably and intubated, you probably going to be intubated as of now because it's so hard to get the tube out when you are actually COVID-19. That's very interesting point. The other viral, like pneumonia, we were dealing with, they are very short time in the intubation period. However, this one is just a little longer on the vent setting. When you get like this period that you are really, it means that you are going to recover, meaning like is a score. If you get able to out of the tubing, it means that hopefully like you are getting the right track. So what happens? This is the virus just involving many organs, not lung only, brain, lung, heart, kidneys. So for that reason, we've been seeing a lot of organ damages that is going to be healed in longer periods. So that's the other part of the COVID-19. This is economy. It is this health economy is going to be probably like reshaped by the COVID and after COVID injured patients. So the milder symptoms that we were like dealing with, that as I told you, taste and smelling, may even come longer to go back, the real, like, you know, the sense of it. So interestingly, like this, I am the nephrologist, I'm kidney specialist, I am seeing the horrible injury on the kidneys that I am hoping that is going to be recovered, but it's going to be a longer recovery. Even though the time is going to come, they will probably have a chronic kidney diseases. So I believe that I am observing and reviewing tons of the the articles which are not available right now because we are not making it. So this is very new entity. We have like some limited data on it. Based on my experts area that I am always talking, I don't want to talk the other part of, I believe that if you get many, the guests, they are probably going to attribute that either on top of it. But the kidney is going to be so much injured in this COVID-19, unfortunately, disease.
I want to share an image and you can tell us what was happening in that picture.
This is one of my friends also, like friend of mine, and also like having disease. And after he treated, he did try to protect himself. And he was showing me that how he is protecting himself and the other. So that's why I love that picture. It's a little bit more aggressive, more drastic, but he wants to show the carrier COVID-19 is more dangerous than the other who has not. So if you see the carrier COVID-19, if they put the mask, you're decreasing the contagious rate like to almost 5% from the 70%. So that's why he was saying like, hey, look at me. I'm positive. I did treated, like I'm still on the treatment. That's why he sent it to me. But I'm still saying and following what you actually, advise. That's why he sent me the picture that like telling me how he is really, protecting himself and the others from himself and to the others.
And of course, there's been so much conversation in the community about how to protect ourselves. Should we wear masks all the time? Should we wear masks sometimes? Where and when do we wear masks? What would you advise?
So I would, at this time, like we were seeing like 60 to 70% almost contagious rate and already like contained in the population, I am suggesting wear on your mask all the time, with or without like even any carrier status. This is going to protect the others who are not like already diagnosed or who is not in the disease, period. So that's why I would like to keep the social distancing, like definitely like 6 feet. This is the important thing, that you should definitely keep your social distancing even when you are out. And definitely you should put your mask all the time when you are out. Even in-house, we've been talking that we should do it, because in New York City, I'm mentioning, it's like the houses are so small, spaces are like very limited. You are actually very easily can infect or really contain your significant ones. So, but what I was thinking that we are going to live different era right now with the mask, and the mask is going to get the fashionized mask is going to be, colorized, because we're going to live with them for a long time.
Yeah, you talk about infecting family ones, loved ones, and there is this image again you shared with me. I just want to share it with our viewers so that you can just speak to it. It's so adorable, yet so sad.
Yeah. She's my adorable, very lovely, like a younger one, 3 years of age. And she loves like mommy all the time. Mommy tried to like self-quarantine at home. And when she comes from the job, like from the hospital, I am putting myself in the bedroom, right? So, or somewhere else, like always has some kind of like shield between me and my kids. So he and he's not, but like she cannot separate it from me. I told her like, okay, come and see the mother. Like it may be like a wrong, but the shower, she was trying to, because I think that the best time that you are cleanse yourself and like you feel like you are really clean and really prepared. And even though I can't feel like this, and we were always kissing each other through the screen, through the like windows, through the somewhere. Oh. So the time that I did this, I just said like, let me take a picture, because she is waiting for me to be clean to kiss her. Oh. And then she tried to kiss like, the windows, like mommy, go out, come out. So that's the moment for healthcare professionals. So they have like even though they have a shields on their eyes to see the patient, on their actual like bodies to see the patient, and also on their actual like to their friends, their families. I am not seeing my kids very like long time nowadays, and also I can't kiss them since this started. So they are kissing from my from my like head and everywhere, but not like from my face.
This is a reality that many of us take for granted. We don't realize how this is affecting the people on the front line, how it's affecting your families, how it's affecting your relationship with your children. And it's just, this is a reminder. That image will just tore my heart. It's a reminder that you are, as much as you're fighting to save human lives, you also have families at home, and your children need you, your significant others need you, and you're potentially exposing families to the spread. So I think it would be an honor for us who are not on the front line to do our part, to play our part, to just practice social distancing, listen to the public health officials, so that
definitely
so that we can give you an opportunity to go back home without fear and to have a somewhat normal life. But anyway, I could go on and on about that, but we just mostly want to hear from you today. So let's see if there is something that I have. Oh yeah, 2 questions. 1, is there a correlation between ethnicity and infection? And 2, is social disparity a factor in this case?
Yeah. So ethnicity, we've been seeing this COVID-19 with the many ethnicities. There is not like any preservation for ethnicity, but the results on the ethnicities are a little different. Unfortunately, we've been seeing, we have mostly like serving to Afro-American patients, and the population that I am serving for 10 years, they are already in social disparity. They already has many disease with not getting proper treatments. They are already been already complicated in their diseases, and these are already like causing immunity problem. They are having low immunity already before this COVID-19. COVID-19 only probably make things more complicated on the population that I am working on, and most likely that I'm seeing more death tools on the Afro-Americans, what I'm thinking and what I'm actually like observing. And recently we've been involving with some studies showing that just because of the social disparity, or just because of they have already like started this COVID with the lower determinants, making the difference, or they have also like a genetic inheritance that they can more percept on the COVID-19 and get like a very bad outcome, especially in kidney disease I'm mentioning. So we've been collecting the biopsies, like means like in tissue analysis, to just looking for, is there any genetic correlation? That's going to be like tell us in good 2 weeks later. I will share with you too the case reports. So maybe we've been also dealing with some kind of unfortunate like propensity on the Afro-Americans, with whom actually getting more bad outcome in terms of like kidney disease. I'm working on it. We are searching with the NYU affiliations. I'm also like SUNY downstate. So we're trying to understand what is the science behind it, like what is the scientific fact behind it. We're observing, but this is, again, I don't want to bias the things which already I told you that I disagree. I am like promoting this like social disparity talks, but this is important regardless of genetic inheritance or genetic like correlation, variation. Still like social disparity is going to change the outcome in COVID-19, even before COVID-19, during the COVID-19 and after COVID-19. So we should definitely focus on this social disparity already that we've been dealing for 10 years here, more than 10 years, 20 years. Definitely we should be more focusing for the rest of the treatments in COVID-19.
Mm-hmm. So Dr. Akten, before I let you go do what you're doing best, any final words for our viewers about COVID-19 that we haven't covered?
So pretty much we try to cover from the inside the first individual to a little bit more community. And my final words would be that we're going to pass through as a nation. That's like, I think we should keep it always the hope on the top when we were talking and when we were doing whatever we're doing. But the hope is just going to be like really ended, hopefully like 1.5 years smoothly. For what we call smooth transition, I would definitely like, suggest that reopenings and reopening measurements definitely needs to be tailored up more carefully, because we got like a success after 6 weeks. We don't want to lose it. So we don't want to actually bounce on what we already been there. So for that reason, I believe the final words, keep like social distancing, and definitely keep your mask. Follow up like, with the public actually health announcements very closely, and teach the kids at home how they behave in this situation, how they manage the situation. That's also important. We are adults, but we are living with the families. Each family members needs to be learned, educated. From the like 5 years old to like 85 years old. We should definitely educate everybody this coming 2 years in terms of COVID-19. But we will get through this. We got it. We will going to do it again.
This coming 2 years, that's a scary thought. But but anyway, I would like to thank you for taking the time off your busy schedule to share your frontline experience with us. Thank you for being a hero. I know you don't like to be, referred to as one during this unprecedented time. We as a human race are depending heavily on people like you to help us through it. But I know that we also have to play our part to listen to public health officials, maintain social distancing, and maintain all the guidelines that are given to us. And so this is, I add my voice to people who have already urged the communities to please, let's play our part in keeping us safe and also not overwhelming the healthcare system. And with that, I would like to thank everyone for watching Whitefield. Until next time.
Thank you so much.